Everyone, Sandy Grove, registered nurse with Health Tracks at Home again. Today we're going to talk about some forgetfulness tricks, and we're going to cover some reasons for temporary memory issues, and then also how to deal with permanent short-term memory loss that might affect safe medication management in your home. So whether it's yourself or it's your spouse or a friend or a relative or someone that you're caring for, faced with forgetfulness challenges, it can put you at risk for ending up back in the hospital. So we want to kind of talk about some of those things. Fear kind of gets in the way, and that's one of those issues that people don't want to address. But there are a lot of reasons why we have memory issues, and they're not permanent, and it's okay. We just need to learn what to do when they hit us. So medication safety, those temporary memory loss issues can be caused by a number of things. First thing is lack of sleep. We've known for a long time that sleep is very, very important, and it's an underappreciated cause for forgetfulness. And it's very easily fixed. Make sure you get some sleep. Also, new medications, especially for depression and anxiety and blood pressure, can cause temporary memory loss. It seems to resolve with time, but at the beginning you can feel a little wonky. So post-anesthesia, you've had surgery or you've had a procedure, and the anesthesia confusion, as we would call it, can last up to 2 weeks afterwards, or it can act even longer if you've been under anesthesia for a long time. So you have to learn to deal with it until it resolves, and we'll talk about putting some things into practice that might help. Dehydration, number one cause of confusion in the elderly, or urinary tract infections. This can cause you to have confusion. So you want to research, and I'm going to say that again later on, research when you have some memory issues. Illnesses with fevers or long-term illnesses can affect your memory, and it can return afterwards. After you are over it and you're feeling better, your memory issues can resolve. Stress, feeling overwhelmed, angry, having anxiety, PTSD, or any other kind of just trauma that's happened in your life, an automobile accident, a death of a family member, etc., can cause memory issues just because you're overwhelmed. Your brain is going, I need to rest. So obviously depression causes memory issues, grief causes memory issues, and many of us don't realize that. And grief can last for a long time, up to a year or two. So it can cause memory issues. Medication interactions with food and other medications, we talked about that a couple weeks ago and last week as well, looking to make sure you're not eating the medicines you're not supposed to, foods you're not supposed to with certain medications. Breathing issues, lack of oxygen, people with respiratory issues that have become chronic can have problems with memory issues due to that. Get your oxygen up and you're going to think better. And underactive thyroid, very big reason for memory loss. Alcohol and smoking, they both affect your vessels, and it can be short-term and it can also be long-term. So we'll talk about that under the long-term reasons. So those are a few, and there are many more that are reasons for short-term memory loss. And this is when you don't want to be afraid. You just want to research those and find out what's going on. Don't assume you have Alzheimer's. It could be something very simple and very treatable. So please make sure you deal with it. So there are some reasons for permanent short-term memory loss that can increase your risk for medication issues and overdose or under administration of medicines, and can you end up plunking you back in the hospital. So as we know, dementia is related to circulatory issues, and that can affect people. History of a stroke can affect the memory, not always, but it can. History of a brain injury, again, not always, but it can. A hard knock on the head due to a fall, due to falling back. The most common one is the garage door falling on your head, a car accident or assault where you've been beaten up, or if you were part of a wrestling team or a boxing team and you did that deliberately. All of those things can cause short-term memory loss in the long term. Surgery of the brain due to tumors or an anomaly, we know that that is an obvious one that could affect our memories. But also an infection of the brain, meningitis, can affect the memory long term, and we don't know if COVID will. So There are some weird things we're finding out about people that have had COVID that may be long-term. We'll probably know in 10 years. We know Alzheimer's disease. We know alcohol abuse and smoking have long-term effects on the circulation of the brain by narrowing the vessels. So those are some of the biggies. And there's many disease processes that affect the memory on a long-term basis, but I could sit here all day listing those. So memory assistance is needed whether it's temporary or it's permanent. So suggestions to keep medication management safe are to be informed. That's the first thing. Like I said, research the reasons for intermittent memory issues. It may be easily remedied. 2, create a routine. Routine will help you remember to take your medicines. What are you going to do when you're busy? What is going to remind you to take your medicines at work, etc.? Create a routine. Be clear, set regular times, and stick to it. Create a habit. Your brain will then remember on its own. Oh, I didn't take my 6 o'clock meds. Whoops, we went into the bedroom instead of out into the kitchen. My brain is going to tell me that I need to take my medicine. So you need to be clear, set regular times. And then, as we've talked before, using pill boxes, using envelopes. A lot of people like using envelopes. Medication cups, pouring your meds in a medication cup, sitting it somewhere where you'll see it so you don't forget your evening medicines. Medicine cards, some people have little flashcards they stick around their house, or some method that works for you that make sure that you're getting this daily administration of your medicines. Whatever works for you, be creative. Set the pills in front of you if you're working or you're going to be on a project and you have to take medications at a certain time. Women, when we're doing our craft projects, my brain goes, and I don't think about it. So set them in a little medicine cup next to you so you remember to take it if you have medicines that are in the middle of the day. Always have a written list like we talked about before with the doses and the times to take them. Sometimes that's all people need is a list sitting out. And also I recommended color coding bottles or labeling them so we know what we're supposed to take next. Turning the bottles upside down. A lot of people like to do this. They're all up in the morning. They turn them upside down when after they take their medicines, and that works. But on the long term, it's not going to work. So you might have to have some other kind of system. So write reminders in another part of the house so that medications are not just overlooked. Like I said, you go into the bedroom and decide to watch a TV program in the bedroom, and you're not in the kitchen where your medicines are living and you forget your evening meds. I have done that many times. Have a sign next to your bed that says, did I take my meds? Put a little just put one with meds and a question mark. And then alarms. If we have a cell phone, we can put an alarm on our cell phone that reminds us to take our medicines. Also on our computer, a lot of time people put a reminder on their computer for that as well. So when all else fails, there are things that are out on the market now. Thank God that these wonderful people have created these that are electronic pill dispensers. They go anywhere from $30, which is a simple version, to about $2,000 that can keep your family member safe, especially if they live in another part of the United States and you're trying to manage their medication administration. These automatic pill dispensers are lifesavers. Unfortunately, Medicare does not pay for them, so this is something that you'd have to discuss as a family financially what you wanted to do. And I would just recommend you go and look up online best auto pill dispensers of 2020, and there's a whole bunch of them there. I found a whole bunch I'd never even seen before, and they're wide range from $30, like I said, all the way up to $2,000. So you can look. Hero is a really common one. It holds about 10 medications if that's all you're dealing with. It's a reasonably priced, and it's a good medication dispensing system. There's also Live Fine pill dispenser. If you're techie, there are Pillsy smart caps that go onto the medicine bottle and are Bluetooth, and they alarm if you don't take them. I love that. There's another thing called a Medicube, which is very expensive. However, it alerts the caregiver across the United States or anywhere you want to that medications haven't been taken. It also gives refill alerts and all of that. So if you want a no-brainer, you spend the big bucks and it takes care of everything for you. And it can hold up to 90 days of medications inside that cube. So if you want to spend that much money, it's a good thing out there on the market. So that's all today for medications. We'll talk next week about some memory exercises like we've been talking every week. I didn't feel like I needed to do that this week because this is all about memory. So, COVID update for this week. And we've given more than 5 million vaccines already in the state of California, which is wonderful. And J&J vaccine is coming out shortly, hopefully by the end of the month. It'll be approved and ready for administration. COVID cases are dropping in the state of California and in San Diego County. However, we're still in the purple tier and should be cautious. So the variants, an update on that, the UK variant, there's about 137. I think that's the last time I looked in San Diego County. And they just announced yesterday that the South African variant is now in California. So we don't know. Right now, we know there's at least one. We don't know how many are here. So those are dealing with other things that we don't quite know yet. So be careful, be safe out there still. Exercise tip and stress reliever of the day is walk for your mind. It clears the cobwebs, it helps bring things into a clearer view, and it'll help you to remember things. Memory preservation and nutrition tip is water. Water is necessary for every cell in your body, especially your brain, and dehydration, like I said, can cause confusion and memory issues. Make sure you keep hydrated. Our bodies are made up of approximately 70% water, and 73% of that is in the brain and the heart. So refill the tank frequently. Easy thing. So I hope this has been helpful to you. I hope it will help you with long distance caregivers. I've been under this stress before, taking care of parents and having to make sure they had their medicines, or anybody else in your family that may need help. I think we all know somebody that could use some help regarding memory and medications. And remember, don't be afraid to find out what the reason is for your memory issues. Many are treatable. Don't let fear keep you from having a quality lifestyle and keep you out of the hospital, hopefully. So as always, I get my information from reliable sources. And if you have any questions, please make sure you contact your primary care physician. Until next time, may God bless you and keep you safe. And remember to protect yourself by wearing a mask, social distancing, and washing your hands until we can say we've lowered our tier. God bless you. Take care until next time. Bye-bye.